Then we move on to the discussion of development of placenta and find a question asking us false statement. Remember, if you're talking about tertiary villus, then it will be appearing at day number 17 to 21. It is actually the same time when the fetal placental circulation is also established. Placenta has two components, one is fetal, one is maternal. The maternal component is deciduobacillus and the fetal component is chorion frondosum. So choice number CD is okay, choice number B is also okay, but choice number A is false. That is our answer. Let us explain why that is the answer. Now, first we have to talk about extraembryonic mesoderm. Actually, there is embryonic mesoderm and then extraembryonic mesoderm. Extraembryonic mesoderm is the one which is going to help in formation of placenta. Let's move on to the further details. We have known that there is a dorsal amniotic cavity and ventral is the yolk sac cavity. At present, it is called as primary yolk sac. There are two layers. There is a columnar cell which is called as epiblast, which is on the dorsal side. Whereas the ventral is the hypoblast and it is cuboidal cell. Later, the hypoblast is removed and do not contribute to the embryo. Embryo is basically coming from epiblast. Then what is hypoblast doing? Hypoblast is removed from the baby and contribute to the extra embryonic structures like it is going to form extra embryonic endoderm. Now, when you say it is forming extra embryonic endoderm, it's a controversy that who is forming extra embryonic endoderm. I say it is by the hypoblast. And what else? Then there is one more controversy. It is asking extra embryonic mesoderm. Who is forming that? This is extra embryonic mesoderm because it is outside the embryo. So who is forming that? As I gather from a lot of information is available in the literature like journals and books, some will say that extra embryonic mesoderm will be coming from the trophoblast. Other scientists will tell, no, it is not from trophoblast, it is from epiblast. There is another group of scientists which will say, no, it is hypoblast. So, thus, it is a controversy. Who is giving extra embryonic mesoderm? Is it the trophoblast or epiblast or hypoblast? Recently, there is a consensus that primary yolk sac is lined by some cells and those cells will form extra embryonic mesoderm. Then, what are those cells? That we still don't know. Then what is the answer? If somebody asks me, where is extra embryonic mesoderm from? Your first answer should be, it is from the cells lining primary yolk sac. And if it is not in the option, then you say extra embryonic mesoderm is coming from the hypoblast or epiblast or trophoblast. So any of the three could be the answer. But the very first answer you should take is primary yolk sac. So primary yolk sac is going to form extra embryonic mesoderm. Yes, that's what you remember. Now, what happens is, there is a amniotic cavity, the yolk sac cavity, and there is a third cavity which is called coelomic cavity, developing inside the embryo. But there is one extra embryonic coelomic cavity also. Where is that developing? If you say extra embryonic coelomic cavity, that develops here within the extra embryonic mesoderm. You mean to say now there is some cavity going to develop here within the mesoderm? Yes, and that cavity which develops within the mesoderm is not all around. It will be missing from this area. Which area it is missing from? From this area. If it is missing from this area, what is that called as? That will be called as the connecting stalk. Primary umbilical cord. So some connecting stalk will form or primary umbilical cord will form. Yes. Can we see some diagram for that? Yeah, the next diagram comes like that only. So notice there is one amniotic cavity within the embryo. There's a yolk sac cavity within the embryo, and there's a coelomic cavity within the embryo. But then there is one extra coelomic cavity also, and that extra coelomic cavity or extra embryonic coelom is developing outside the embryo. Here it is. As I'm telling, this extra embryonic coelom which is developing, it is developing in the extra embryonic mesoderm, and it is not complete. It is not complete, and there is some portion left. And what is that called? That is called connecting stalk, which is the primary umbilical cord. So that is going to become primary umbilical cord. Yes. Notice one more thing. This extra embryonic coelomic cavity is dividing extra embryonic mesoderm into two parts. The one which is towards the yolk sac, which is now called as secondary yolk sac. Understand, when the coelomic cavity has come, the primary yolk sac would have become secondary yolk sac, and the extra embryonic mesoderm, which is along with the yolk sac, is called as the splanchnic extra embryonic mesoderm. So this is called as the splanchnic extra embryonic mesoderm. What is splanchnic? Splanchnic means visceral, the one which is in communication with the yolk sac. So the mesoderm, are you trying to say this mesoderm? Yes, this mesoderm, the extra embryonic mesoderm which is lining the yolk sac cavity is called as the extra embryonic splanchno-pleuric mesoderm. Then what about the other layer? Other layer is called somatopleuric. And where is the somatopleuric then? If you want to see the somatopleuric, this one is the somatopleuric extra embryonic mesoderm. Now if you say this is the somatopleuric extra embryonic mesoderm, is it lining the amniotic cavity? Yes, it is lining the amniotic cavity, and it is called as the somatopleuric extra embryonic mesoderm. But I see it is going outside also. Yes, it is going outside also. So this is now all around the embryo. Yes, actually it is all around the embryo. Actually, it is also contributing to the primary umbilical cord. See one thing here, the extra embryonic mesoderm is divided into two. Namely, there is a splanchnic extra embryonic mesoderm which is lining the yolk sac, and except that whatever is somatopleuric extra embryonic mesoderm, which will not only line the amniotic cavity but also the outer side of the baby, and contributing to primary umbilical cord or connecting stalk. This is all about placenta and placental membrane. Like which one? There's the amnion and chorion. What about the amnion? Amnion is the one which is covering the amniotic cavity. That is the amnion. Can you tell me the amnion which is covering the amniotic cavity, what is it contributed by? Amnion is a membrane which is contributed by amniogenic cells. And along with amniogenic cells, it is the somatopleuric extra embryonic mesoderm. Now, if you say this is the amniotic cavity, which is having a floor of ectoderm, is having some roof and lateral wall made by amnion, is contributed by amniogenic cells. Yes, plus the somatopleuric extra embryonic mesoderm. Yes, but who gave the amniogenic cells? Amniogenic cells were given by trophoblast. The trophoblast, which is at the periphery, that trophoblast is giving us amniogenic cell. Then what about the chorion? Chorion is outside. If you say chorion is outside, fine, but what is chorion contributed by? So this is chorion, and chorion is outer trophoblast, and Along with that, it is somatopluric extra embryonic mesoderm. So you're trying to say extra embryonic mesoderm is with the chorion and amnion also. Yes, maybe it is amnion or maybe it is chorion. It is both having somatic extra embryonic mesoderm. Let's draw the same diagram now ourselves. This is the embryo having a dorsal columnar cell, which is the epiblast, and ventral is cuboidal hypoblast. Remember, this hypoblast is the cell which is removed from the baby, and it is contributing for extra embryonic endoderm, extra embryonic mesoderm. Actually, it was forming a layer here, and that is called Husser's membrane. What is that? It is called as Husser's membrane. Now, when you say it is the Husser's membrane, it is lining the yolk sac here. This is the yolk sac cavity, primary yolk sac cavity. This is the amniotic cavity, which is dorsal. So hypoblast is going to form Husser's membrane. It is also forming extra embryonic mesoderm. Now you will also notice there is some trophoblast at the periphery, and that trophoblast which is at the periphery, the trophoblast which is at the periphery is dividing, and it is forming some multinucleated stage. What is that called? Actually, there are two types of cells. One is called as syncytial trophoblast, and the other one is called as the cytotrophoblast. So you are telling outer cell mass. Yes, two types of cells are there in the second week. Second week is the week of 2, means epiblast, hypoblast, and amniotic cavity, yolk sac cavity, and cytotrophoblast, syncytioblast. Okay, now somebody told us that it is the trophoblast which is going to form the extra embryonic mesoderm, but then somebody else is telling it is formed by the epiblast. Then there is somebody else who is telling no, extra embryonic mesoderm is formed by hypoblast. And then the latest is, let me first show you the extra embryonic mesoderm. So this is the extra embryonic mesoderm now. Yes, I think this extra embryonic mesoderm is going to be formed by trophoblast cells. Yes, old story. Then they said extra embryonic mesoderm is by epiblast. Then they said it is by hypoblast. Now the latest is the extra embryonic mesoderm is coming from primary yolk sac. Primary yolk sac. Also, notice one thing. This trophoblast were forming amniogenic cell layer. Now, when you say there is some amniogenic cell layer, this is the amniogenic cell layer, which is going to form amniotic fluid in the amniotic cavity. Who is giving that? The amniogenic cells are coming from trophoblast. Later, you will find this extra embryonic mesoderm is developing a cavity, which is called as extra embryonic coelomic cavity. Let us discuss that extra embryonic coelomic cavity now. Let us start from the periphery. You will find this is the periphery. You are having some cytotrophoblast. Now, if these are the cytotrophoblast, I believe that this cytotrophoblast were dividing and losing cell membrane. Yes, they were. And when it happened, there were some other cells with multinuclear appearance, and that is called as syncytiotrophoblasts. These two are going to help in formation of placental membrane, like chorion. So you're telling that chorion has cytotrophoblast plus syncytiotrophoblasts? Yes, one more thing. And what is that one more thing? Extra embryonic mesoderm. By this time, what would have happened is the ectoderm would have formed and the mesoderm would have formed and the endoderm would have formed. So you are telling that the three germ layers would have formed from epiblast? Yes. So epiblast would have formed the three germ layers. Yes. And what happened to hypoblast? Hypoblast removed. But that hypoblast which was removed was forming a user membrane. Yes, it was forming that user membrane. But now this is secondary yolk sac. Now if you say this is secondary yolk sac, why would you say that? Because one cavity has developed. What cavity has developed? Why do you say it is secondary? You remember we have told there was some mesoderm outside the baby. See, this mesoderm is embryonic mesoderm, but there is extra embryonic mesoderm also. And let us look at that. So this is the extra embryonic mesoderm now. Yes. And that extra embryonic mesoderm which you are showing here, this extra embryonic mesoderm which you are showing here will develop a cavity. And what is that cavity? You will notice that it is two types now. What are the two types? You will find that there is one which is on the outside and there is one which is on the outside and there is one which is on the inside. So how will you name them? And what is the cavity between the two? The cavity which is between the two is called extra embryonic coelom. So you are mentioning now extra embryonic mesoderm is two parts. Yes. And between the two layers you have some extra embryonic coelomic cavity. Yes. And there will be the extra embryonic mesoderm which is lining the secondary yolk sac. Now this extra embryonic mesoderm which is lining the yolk sac is called as the splanchnic layer of, there's a splanchnic layer of extra embryonic mesoderm. If you say there is a splanchnic layer of extra embryonic mesoderm which is lining the yolk sac, then what is the other one called? Other one is called as the somatic layer of. So this is the somatic layer of extra embryonic mesoderm. Yes. Where do you see somatic layer of extra embryonic mesoderm? Outside this cavity. And what is that cavity? That cavity, the extra embryonic coelomic cavity. Where all do you see this somatic layer? It is covering the amniotic cavity, and when it is covering the amniotic cavity, that time this one which you are telling somatic extra embryonic mesoderm along with the amniogenic cells, you know, there were some amniogenic cells here formed by trophoblast, those amniogenic cells and this together will form amnion. This membrane is called as amnion membrane. First of all, amnion is the membrane which will cover the amniotic cavity contributed by amniogenic cells and also extra embryonic mesoderm. Which one? The somatic extra embryonic mesoderm. And where is the visceral? Visceral is just covering the secondary yolk sac. Also, you can notice this extra embryonic mesoderm is contributing to connecting stalk, and that connecting stalk is going to become umbilical cord. So extra embryonic mesoderm is contributing to connecting stalk, which is primary umbilical cord. Yes, and it is also contributing to chorion. Then what are the three things in chorion? The three things in chorion are: number one, syncytioblast; number two, sideroblast; number three, somatic extra embryonic mesoderm. So you are telling this all is the chorion. Yes, actually three things: somatic layer of extra embryonic mesoderm plus sideroblast plus syncytioblast. That is chorion, placental membrane. Now that chorion is going to form some finger-like processes called chorionic villi, which are primary, secondary, and tertiary. And there was a question when the tertiary chorionic villi will appear. And we said it is day number 17 onwards. So when we talk about the yolk sac, it is primary, secondary, and tertiary. Let me show you one diagram for the same. In the beginning, there is the primary yolk sac. Then there is a secondary yolk sac. And then there is a tertiary yolk sac. Actually, when there is a cephalocaudal folding, the yolk sac was incorporated into the baby to form the gut tube. That time, a small part of yolk sac is left in the connecting stalk, which is the primary umbilical cord, and that is called tertiary yolk sac. Then when do you say there is a secondary yolk sac? When I had this extra embryonic coelomic cavity formed. So in the beginning, you have primary yolk sac. Yes. And then you have secondary yolk sac when you have the extraembryonic coelomic cavity coming. Yes. And then you have tertiary yolk sac when the yolk sac is totally unincorporated into the baby, but some parts was still left in the connecting stalk. Yes, that was the tertiary yolk sac. Now let us focus upon placenta components. There are two of them. One is maternal and one is fetal. Maternal is the uterine component, which is called decidua basalis. And the fetal is the chorion fundosum. Let us look at some diagrams now for both the component of placenta. Here we are looking at the uterus, which is lined by the endometrium. And that endometrium is having name like decidua parietalis, decidua capsularis, and there is a decidua basalis. This is all endometrium of the gravid uterus, means the baby is already there, gravid uterus. The endometrium has three parts. The one where the baby is implanting, that is called decidua basalis. And that decidua basalis is the one which is going to form the uterine placenta or maternal placenta. Now there is some decidua which is covering the baby towards the uterine cavity, and that is the decidua capsularis. It is not forming placenta. And then rest of the endometrium, which is there in the uterus, is called decidua parietalis, and of course it is not forming the placenta. Then what about the fetal placenta? As you talk about fetal placenta, chorion will help us. You see, we have discussed the decidua, three components, and it is the basalis which is helping us forming placenta, that is the maternal placenta. What about the fetal placenta? If you remember, the fetus is covered by chorion. What is chorion? Extraembryonic mesoderm plus cytotrophoblast plus syncytiotrophoblast. This is chorion. And that chorion is having finger-like projections, and those finger-like projections are called as chorion villi. Now these chorion villi, they want to penetrate the maternal placenta to have some utero-placental or the fetal placental circulation to derive blood from the mother. But then these finger-like projections, the villi, will be lost on this side of the baby, means towards the uterine cavity. Only the villi which are towards the decidua basalis will persist, and there, those finger-like projections, it is going to form the chorion fundosum, the fetal part of the placenta. It is going to communicate with the decidua basalis, which is the maternal part of the placenta. The chorion, which is in contact with the decidua capsularis of mother, the chorion which is losing the finger-like projection will be called chorion levi. So there is a chorion levi and decidua capsularis, but this is not for placenta. Placenta is just the chorion fundosum and decidua basalis. These two are towards the uterine cavity, and they don't have any contribution towards placenta as such. Now you will notice this is the baby. And what is this baby suspended in? Amniotic cavity, which is covered by amnion membrane. So this is the amnion membrane which is covering the amniotic cavity. What is around that? The chorion. And if you say around that is the chorion, this is the chorion. This chorion, which is around the baby, is contributing to placenta, and that placenta is finger-like projection, and that is chorion frondosum. If this is the chorion frondosum, then what about the chorion towards the uterine cavity? That is chorion levi, and it is not for placenta. This chorion levi is towards the decidua capsularis, but decidua capsularis is not going to help us in the placenta formation. Then who was helping? That was actually the maternal side placenta, and that was the decidua basalis. So decidua basalis here, right? Then what is this? This is decidua capsularis. And what is this? This will be the decidua parietalis. So they are not actually at all helping us in formation of the placenta. Placenta is not from these two. It is from decidua basalis. And you can also notice that there is a tertiary yolk sac which is seen here. Along with that, you can also see primary umbilical cord, that is the connecting stalk, which is connecting to the placental region. It is going to become the umbilical cord proper later. So we are going to draw the same diagram now. Let us start from the uterus. And you can mark this as the decidua parietalis, lining the uterine cavity. And you will notice decidua parietalis, which is lining the uterine cavity, is continuous with one more decidua. This is what we are calling as the decidua capsularis. If that is the decidua capsularis, then we also have seen decidua parietalis. And between the two is the uterine cavity. But where is decidua basalis? If you say decidua basalis, then it is here. Now, this decidua basalis is the one which is contributing to placenta, maternal placenta. What about the fetal placenta? Let's show the fetus. As you show the fetus, this is the fetus. And what is the fetus suspended in? Amniotic cavity. As you say, fetus is suspended in the amniotic cavity. What is amniotic cavity lined by? It is lined by the amnion. Now, if you say this is the fetus which is in the amniotic cavity lined by amnion, what is beyond that? Beyond that, you will find there is chorion. The chorion is contributing towards the fetal placenta. So where it is? See, it is giving us finger-like projections. Oh, the chorion frondosum. Yes. And what is this? This is the chorion levi. So that is the chorion levi towards the decidua capsularis. This is not placenta. It is this finger-like projections which is chorion frondosum. So chorion frondosum plus decidua basalis, together they form the placenta. Understand that this amnion, which is lining the amniotic cavity, is continuous on umbilical cord also. So you can notice this will be the umbilical cord, which is basically connecting the baby with the placenta, and on that is also covering of the amnion. So amnion is going to cover umbilical cord for some time, but beyond that it will be covered by the chorion. See, placenta is covered by chorion. The placenta is covered by chorion, and the umbilical cord is covered by amnion, which is also covering amniotic cavity there, suspending the fetus in the amniotic cavity. This is amniotic cavity, yes. And this is the chorionic cavity, yes. And this is the uterine cavity, yes, it is. Now we want to look at a diagram which is telling us about primary, secondary, and tertiary chorionic villi. If you say it is primary chorionic villi, then it will be the cytotrophoblast forming syncytioblast together, forming the primary villus, the finger-like projection of chorion. But when the extra embryonic mesoderm comes, which is somatic layer of extra embryonic mesoderm, that time it will be secondary villus. So extra embryonic mesoderm has come, which is somatic extra embryonic mesoderm, to form the secondary villus. And then some fetal blood vessels will come and will become tertiary villus. Let me show you another diagram for the same details now. So you understand, in the beginning, when you say primary villus, it is some finger-like projection from the chorion frondosum. There is the cytotrophoblast, and which was dividing to give syncytiotrophoblast. So cyto plus syncytio is primary villus, but later, when it is secondary villus, some extra embryonic mesoderm has come. If you say this is the extra embryonic mesoderm which has come, it is syncytioblast plus cytotrophoblast plus extra embryonic mesoderm, and that is secondary villus. In tertiary villus, one more thing has come, and that is the fetal blood vessels. So fetal blood vessels also have come. So what are the total component? Fetal blood vessel suspended in the extra embryonic mesoderm, surrounded by cytotrophoblast, surrounded by syncytioblast. That is the tertiary villus, when it will come day number 17 to 21. So 17 to 21 means week number 3. Yes, and there's the time when the fetal placental circulation is also established. Let's talk about that as well. See, this is the uterus, and it is supplied by uterine artery. So now the uterus is having a baby, which is having a attachment to uterus, where there is the uterine placenta and also fetal placenta. Now when you say this is the uterine placenta and this one is the fetal placenta, in the beginning what happens is this uterine artery is going to supply. This uterine artery is going to supply the uterine placenta, and it is called uterine placental circulation, beginning at day number 12 of life. So in the beginning, the uterine artery supplies the uterine placenta, and it is called uterine placental circulation, happening at day number 12 of the intrauterine life. But later, this blood will also enter the fetal placenta. When will that happen? This is called as the fetal placental circulation. And when the fetal placental circulation is beginning? A bit later. And when is that? The fetal placental circulation will begin at day number 17. Some books will say day number 21. So Williams Obstetrics will say day number 17, and books like Datta Obstetrics will say day number 21. Yes. But how can you call it as fetal placental circulation? Why? Because this is not fetus. Then what it is? It is embryo. This is week number 3. This is embryo. That's why you're using a misnomer. Instead of calling it as fetal placental circulation, you should say embryo placental circulation. Now, coming back to this question, you will notice that we were wanting to have a false statement. We already mentioned this is false statement because tertiary villus is not at day number 10. It is day number 17 to 21 when the fetal placental circulation has been established. And what about the dearmedicoz? Maternal placenta. And what about the fetal placenta? Chorion frondosum. So we'll keep our answer as choice number A. Yes, because it is day number 17 to 21.